I'm going to be talking a bit about Healthy Recovery, which is a program that kind of looks at smoking, diet and physical activity in people who are attending residential treatment services. And I'm going to specifically talk about Indigenous focused services and some research we've been doing there. So I'm Isabella. I'm part of a team from the University of Wollongong, Newcastle Uni, Uni of New South Wales and also Melbourne Uni. Before I go any further, I too would really like to acknowledge the traditional owners of the land we're on today, but also the traditional owners and elders of the land that we've been actually working on at these services. I'd really like to support the following thank the following organisations for their support. So the Cancer Council New South Wales, the Heart Foundation and the Cancer Institute of New South Wales have provided the funding for this research. Also, Drug and Alcohol Services of Alice Springs and the Salvation Army. So we've had a pretty long-standing partnership with the Salvation Army, and without their support we just couldn't be doing this type of research and looking at how feasible it is to try and be targeting these health behaviours in these populations. So I guess to get started, I just want to paint a bit of a picture as to why we think it's pretty important to be looking at health behaviours in this population. So the life expectancy of people with a history of substance abuse problems is 20 to 27 years less than the general population. So that's nearly 3 decades that this population is losing from their lives. In addition, Indigenous Australians demonstrate much poorer health outcomes across almost all diseases, at all ages, in men and in women, and in both remote and non-remote areas. So we all know here it's widely reported that there's a significant health gap between Indigenous and non-Indigenous Australians. And it's really a national priority to be looking at ways we can start closing this gap. So cardiovascular disease is the leading cause of death in Australia, and it's actually occurring much, much earlier in substance-using populations. In addition, we know from research that Indigenous Australians are 1.3 times more likely to develop cardiovascular disease than non-Indigenous Australians. Cancer is another leading cause of death in substance use populations. So the incidence of cancer is actually slightly less in Indigenous populations, but there's research suggesting that Indigenous Australians are actually more likely to die from cancer. So this is probably largely due to treatment access, but also the different types of cancer that are occurring. So lung cancer is really prevalent in both substance use populations and in Indigenous populations, and this is most likely due to the really high rates of smoking. Finally, diabetes is another common chronic disease. Diabetes, actually, Indigenous Australians are 3.5 times more likely to develop diabetes, and again, this is occurring much earlier in life. We also know diabetes to be a risk factor for cardiovascular disease. So these risk behaviours are common to cancer, cardiovascular disease and diabetes, these being smoking, drug and alcohol use, obesity, lack of physical activity and a poor diet. All of these risk behaviours too are things we can actually change. They're modifiable, so we can start doing something about them right now if we choose to. So smoking is really, really common in substance using populations. There's actually research suggesting that people who are accessing residential treatment services are more likely to be heavily nicotine dependent and smoke more cigarettes per day. There's actually also some research suggesting that 88% of Indigenous Australians who are attending residential services are smokers. Well, obesity isn't a behaviour. We know that it's a risk factor for these chronic diseases, and we also know that we can combat obesity by focusing on diet and exercise. So at the moment, treatment services are focusing on drug and alcohol use, but I actually think there's a really good opportunity in these services to be combating some of these other behaviours and helping to reduce the incidence of cardiovascular disease and cancer and diabetes in these populations that are particularly vulnerable to developing them. And that's kind of what our research has been focused on, is trying to help people to reduce their smoking, to eat a bit better and do a bit more exercise. So we've developed this program called Healthy Recovery. It's an 8-session group-based program. I'm going to give a bit of a simple rundown of it today. Hopefully it's not too complicated for anyone. It was designed by our research team specifically for substance abuse populations. So we've just been trialling the Healthy Recovery program around residential services in the Central Coast, in Canberra and in Sydney. And these services are a bit more mainstream, and it's been looking pretty promising, like it actually is helping people to improve these health behaviours. I'll talk a little bit more about the results of that pilot study later on and give a bit of a comparison of those results compared to the ones we've found in the Indigenous focused services. So the overall goals of the program are to help people to reduce their smoking, or ideally to quit smoking, to increase their levels of physical activity, and also to improve their diet. So we specifically focused on fruit and veg intake. I don't know about most of you here, but I'm psych trained, so to me nutrition can be pretty complicated. But we do know that by focusing on fruit and veg, we can actually make an impact on health and reduce the risk of chronic disease. So I'll briefly talk through kind of what Healthy Recovery is all about. First of all, we just provide some education about health to people who are participants in the program, and a bit of a rationale as to why it's important to be focusing on smoking and diet and exercise. Motivational interviewing is a really core component of it to help, I guess, strengthen people's commitment to make change and their motivation to make this change. Goal setting was one of the real key components of Healthy Recovery. So as you can imagine, people who have been smoking for 5, 10, 20 years, the thought of giving this up can be really, really daunting. People have also reported that, they're in treatment for substance use. They don't really want to let go of the smoking. It can be their final drug that they can hold on to. So the thought of trying to give it up is something that can be, unfathomable for some. So goal setting and planning and problem solving for any potential challenges that might come up was really, really important. Nicotine replacement therapy was also something we tried to encourage. So there's a lot of evidence suggesting that nicotine replacement therapy can double people's chances of successfully quitting smoking. Interestingly, we found that it wasn't really used by Indigenous Australians who were attending these services. This was actually the case also across the more mainstream services, so people just weren't really receptive to using NRT. And I guess some of the common themes that seem to come up with it, people kind of favoured the cold turkey approach despite the evidence against that. And also, I guess, access to GPs. So we encourage people to go along to the GP and talk about whether NRT would be a safe option for them. And so access to these GPs sometimes was a bit of a barrier as well. We use contingency management in the program. So the idea of this was really just to give people a bit of a pat on the back, provide some reinforcement for the changes they'd made. And sometimes that can be really motivating in itself for people. And finally, behavioural monitoring was a really, really big part of the program. So we use these things we call daily log sheets. And basically we just asked people to write down the number of cigarettes they were smoking per day, and write down the servings of fruit and veg and how much exercise they were doing. It was a really nice, simple way you could get people to have a look at their behavioural patterns and what was going on, and think about where they might want to make some changes or areas that they're currently happy with. I should also mention I've got an email list, and this program's going to be available for everyone, whether you want to use the program as a whole in your practice or just take little bits and pieces or resources from it. We're going to pop it up on a website, and it's just going to be open for everyone to use if they're interested. So why did we choose to try this in Indigenous-focused residential services? Well, as many of you know, these services have such an important role in helping people to improve their health. The residential nature of them, I guess, offers a really secure environment that people have stability, they have supports, and they potentially have some time on their hands to really focus on themselves and making those changes. We were actually approached by some Indigenous-focused services, and they were interested in trialling the program in their services. So The study was developed out of discussions with the Salvation Army at Mount Isa and the Drug and Alcohol Services of Alice Springs. As I said, we were already running a pilot of this healthy recovery program around more mainstream services in New South Wales and ACT, and Salvation Army had started to partner with one of the Aboriginal medical health centres, Gidgee Healing, here in Queensland, and began to kind of support the development of these Indigenous-focused residential services. And they'd expressed an interest in seeing whether healthy recovery might be quite as helpful as it was looking in the mainstream services in these more Indigenous-focused ones. At that same time, the manager of DASA had approached a member of our research team and had expressed a real interest in trying to target smoking reduction as part of their routine care. So we kind of thought this might be a good opportunity just to trial it and see whether it's something that's wanted and might be helpful. So we were fortunate enough to get funding from the Heart Foundation, which meant we could go up to Mount Isa and Alice Springs and do some one-to-one consultations and some focus groups up there. And the idea of this, I guess, was, to meet with clients attending the services, meet with staff and management and some of the local Aboriginal medical centres, and get an idea of whether, firstly, this was something that they actually wanted and were interested in, but also how we could make it the most helpful it could be for them. So we made some modifications to the original version of the program based on these consultations. I guess it was identified pretty early on that literacy might be a bit of an issue, so we really reduced down the written content, and we made some videos just to support delivery of some of the content throughout the program. We also decided that we'd run the program with an Indigenous caseworker at each of the sites, and this was really helpful in just drawing on their local knowledge and experience throughout the groups. It was also a really nice way, I guess, to kind of train the case managers at the sites about, the importance of targeting these health behaviours and also promoting the sustainability of the program for the future. So we ran the study as a pre and post design, basically meaning we measured people's smoking, their diet and their exercise before we ran the healthy recovery program, and then again after the program had finished. And we just wanted to kind of see whether there were any changes in these health behaviours and whether they might be the result of this program. As you'll see up here on the screen, 55% of our participants were Indigenous males and 45% were Indigenous females, and the majority of these people were accessing treatment for alcohol use concerns. 60% of our sample reported being daily smokers, so we actually had some people who didn't smoke quite as often as daily, and we also had some people who participated that weren't smokers at all. And I guess one of the reasons for this is at the Mount Isa service where we were running it, it's actually a really cool, unique treatment centre in that family members can come and live on site with the clients. So often we'd have partners coming along to the group who might be interested in making changes to their diet or exercise, or simply were there to support their partner who was trying to give up smoking. So to get started, we went out to Mount Isa and Alice Springs, and I guess we gave a bit of a recruitment presentation. So we just talked about, this is what healthy recovery is about, who's interested. We also really stressed it's completely voluntary, so there's no repercussions if you're not interested. What was really encouraging to see is that 76% of people we gave this talk to expressed an interest in participating in healthy recovery. Most of the people who weren't interested, they kind of cited being non-smokers as the main reason for this, or stated that they were leaving the rehab soon, meaning they just wouldn't be able to complete the program. I guess what this 76% interest indicates is that people might not necessarily be confident that they can make these changes to their behaviour, but they were certainly interested and willing to give it a go and just learn a bit about it. So we gave this recruitment presentation to 54 people in total, and we ended up doing some assessments at baseline with 42 people, which is a pretty good number for a pilot study. At follow-up, we did assessments with 24 people, so it dropped a bit. As I guess many of you know, People tend to leave treatment settings quite haphazardly with little notice, and this did happen. So 14 people left the service throughout the course of the Healthy Recovery program, and as a result we couldn't do follow-up assessments with them. So I'll briefly talk through the results and what we've found. You'll see on the screen the blue line indicates this Indigenous focused trial that I'm speaking about today, and the red line indicates the trial where we ran this program in the more mainstream focused services in New South Wales and ACT. So in the Indigenous services, you'll see before Healthy Recovery, on average people were saying they smoked about 14 cigarettes a day, and by the end of the program they were smoking on average about 7 cigarettes a day, meaning it looked as though people were halving their smoking by the end. We actually found, I think, 30% of people had completely quit smoking by the end of the program, which is really encouraging to see. And you'll see too the trend in the reduction of smoking is basically identical across the different studies. So I guess that kind of indicates that this program might be helpful for people in reducing their smoking, whether they're attending more mainstream services or whether they're attending Indigenous focused services. So in terms of fruit consumption, national guidelines recommend that we eat 2 servings of fruit each day. So what was really nice to see is that people in the Indigenous focused services were already eating the recommended level of fruit. So it wasn't necessarily something that needed improvement. There was a slight increase in fruit consumption to 2.8 serves, but this wasn't a statistically significant improvement at all. In terms of vegetables, so at the beginning people were eating about 2 servings of veg each day, and by the end of the program it had increased to almost 3.5 servings each day. So again, the national recommendations are that we eat 5 servings of veg every day. You'll see, I guess even by the end of the program, people still weren't quite getting to those recommended levels. And there are a couple of reasons. I guess in a residential setting, it's probably a bit easier to increase your fruit intake than your veg. Your meals are served for you. Also, I guess in Mount Isa and Alice Springs, in these more remote communities, people often cited access to fresh fruit and veg could be a bit tricky. And for physical activity, we measured this in something called METS. This stands for Metabolic Equivalent of Task. This basically just gives an idea of how much energy is used to perform a certain task, and it's a pretty standard measure across research. So in our Indigenous services we did this program at, the activity was actually really quite low to begin with, so 1,000 METs, and it significantly improved, so 2,800 METs by the end of the program. However, this is still quite a low level of physical activity, and you can see there, though, it did improve quite significantly compared to the more mainstream focused services where people were doing a bit more exercise at baseline. I guess some of the reasons for people not quite getting to the higher levels of physical activity even by the end were that in Mount Isa it is mighty hot. I was involved in running some of the groups up there, and in the middle of summer, 45-degree days, it's pretty tricky to get motivated to go out for a run. So it was sort of a lot of problem solving and just really practical thinking about how you could just get up and get moving a little bit. So just going for a walk, planning it, so maybe going early in the morning or late in the evening. At the Mount Isa service too, the buildings were kind of situated up, and then there was quite a long driveway that went down to the front gate near the road, and it was really common that people would sort of go for a walk down to the front gate and back, and when they were doing this they'd have a yarn, they'd take friends with them, and it was nice to see people would challenge themselves and see how many times they could go up and back in a day and gradually increase this. And it was just a really nice practical way of doing it and having some fun while you're trying to do a bit more exercise. At the DASA service in Alice Springs, I believe basketball was pretty popular, so they had a basketball court there, and I think they'd go out and just muck around on the court, kick the footy a bit and do some walking as well. So I guess to sum up, I'm making stellar time here. To sum up, the Healthy Recovery Program, it is a pilot, so we need more research, but it looked pretty promising in helping Indigenous people to improve these health behaviours. So smoking significantly reduced, people were eating more serves of veg and were doing more exercise by the end of the program. There were certainly some challenges, so NRT wasn't really used quite often, and I suspect that if it was received a bit better, the smoking reduction might be even more significant. And again, high attrition, so people were leaving the service, and as a result, we couldn't just get big numbers for the study. We need more research that kind of looks at long-term outcomes. So we'd intended to do a 6-month follow-up for this study, but it was pretty tricky trying to get people's contact details. No one, really knew where they were going to be after the rehab. A lot of people didn't have phones, so it was beyond the scope of this study, but I think future research really needs to endeavour to do that so we can see if these changes are actually maintained. Could we make this program more suitable for Indigenous Australians? Well, absolutely. I think if we were to do it again, we'd do further consultations with the community. We'd probably try and incorporate it more with the case management at the sites. I just think, overall we need more research that looks at how we can really embed this type of program into routine care. As a lot of people have said here, there's a real opportunity to be just having brief chats even with people who are attending the services, whether residential or not, and even that brief intervention can be very helpful. This type of program, it doesn't have to be healthy recovery, but having chats with your clients about smoking and diet and exercise could make a small bit of difference. That's everything. Thank you.